They called it black fatigue, a term that sounded scientific. Neutral. Harmless. But it wasn't neutral. It wasn't harmless. It was a mask. A phrase that hid the truth of how an entire system failed the very people who needed it most. And this is where it begins. With one woman. Angela Williams was 42 years old. A mother of two. She didn't have the luxury of rest. She worked 2 jobs, slept in short bursts, and still managed to show up for every parent-teacher meeting, every soccer game, every late-night homework session. But then came the chest pains, and the dizziness, and the exhaustion that made her feel like her body was shutting down. Angela didn't rush to the hospital, not because she didn't want help, but because, deep down, she already knew what would happen. When you're black, you learn early that hospitals are not always safe places. By the time she finally walked into the emergency room, holding her chest, she was desperate. But the nurse barely looked up. "Just fatigue," they said. And then came the word. Black fatigue. Doctors ran basic tests. No urgency. No alarm. Then they sent her home. 2 days later, she collapsed in her kitchen. Angela's death was not an isolated tragedy. It was a symptom of a disease in the system itself. Because study after study shows it, black patients are 22% less likely to receive pain medication. They wait 30% longer for care in emergency rooms. And when their symptoms are dismissed, they die, silently, invisibly, without headlines. Angela's sister, Monique, refused to let her become another statistic. Monique walked into that hospital like a storm. She demanded answers. And what she found in Angela's chart made her blood run cold. Likely exaggerated. Recommend rest. Exaggerated. That was the word they wrote down while Angela was fighting for her life. But Monique didn't stop there. She filed complaints. She called every advocacy group that would listen. And then, a nurse stepped forward. The nurse was trembling when she handed Monique a stack of documents. Internal reports. Data showing that black patients with serious symptoms were being flagged low priority twice. As often as white patients. This wasn't one bad doctor. This was the system. When Monique leaked the documents, the hospital denied everything. They called it a misunderstanding. They issued press statements about isolated cases. But then more voices came forward. Doctors, nurses, former employees. And they all said the same thing. The system wasn't broken. It was working exactly the way it was designed. The investigation that followed uncovered decades of hidden data, emails, policy memos, and one damning report buried deep in the hospital's archives titled Resource Allocation and Patient Compliance. It was full of coded language. High-resource patients were given priority. Low-resource patients, often poor, often black, were quietly pushed aside. Angela never had a chance. As the story broke nationally, Monique found herself at the center of a media firestorm. News vans parked outside her house. Civil rights attorneys called nonstop. And for the first time, a hospital executive was forced to testify under oath. That's when the real bombshell dropped. An internal training manual surfaced. It instructed staff to be cautious with over-reporting pain in certain demographics. In other words, don't believe them. The fallout was immediate. Federal investigators launched a probe. Protests erupted outside the hospital. And a lawsuit, led by Monique, shook the entire healthcare network. But as the walls began to crack, something else happened. Whistleblowers from other hospitals started reaching out. This wasn't one hospital. It wasn't one city. This was everywhere. Monique became a reluctant activist. She spoke before Congress. She told Angela's story in hearing after hearing. And each time, more families stood up and said, "This happened to us too." A father whose son died after being labeled non-urgent. A mother ignored during childbirth until it was too late. An elderly woman discharged with fatigue, who never made it home. Each story added weight to the case. And here's where the tide turned. A coalition of doctors, nurses, and policy experts, many of them black, banded together to create new legislation. They called it Angela's Law. It banned the use of dismissive terms like black fatigue in medical records. It required bias training for all medical staff. And it mandated federal oversight on patient priority algorithms that had quietly discriminated for this. But the pushback was fierce. Healthcare lobbyists fought tooth and nail to kill the bill. They said it was too costly. They said it would overburden doctors. But what they didn't say was that it would cost them millions in legal settlements if it passed. Monique refused to back down. And when the vote finally came, Angela's law passed by a single vote. One vote changed everything. And yet, this isn't a victory story. Not yet. Because while Angela's law is now in effect, countless hospitals are still fighting to water it. But here's what they didn't expect. Monique isn't done. Because the same documents that exposed Angela's hospital led her to something even darker. An entire network of private insurers with internal policies that go even further. And that's where this story takes its next turn. Angela didn't live to see justice. But her story lit a fuse. And now that fire is spreading. Because the truth isn't just coming for one hospital anymore. It's coming for the whole system. They called it a compliance risk. A harmless phrase buried in thousands of pages of insurance policies. But for families like DeShawn Turner's, it wasn't harmless. It was a death sentence. The lawsuit over Angela's death shook the nation. Her story was a spark, but what came next revealed the fire beneath the surface. A hidden structure of racism coded into the very systems designed to keep people alive. After part one, the nation expected change. Headlines screamed of reform. Politicians promised investigations. But what they didn't tell you is this. Reform doesn't come quietly. Comes only after the people in power have run out of places to hide. And this time, there was nowhere left to hide. DeShawn Turner was 37 years old, a father of two, a man who never asked for pity, only fairness. He worked 2 jobs. He had insurance. He paid his premiums. But when he was diagnosed with aggressive lymphoma, his file was flagged. Not because he smoked, not because he missed appointments, but because he lived in the wrong zip code. The letter came on a Tuesday. One line in black and white. Claim denied. Compliance risk. DeShawn's wife, Aisha, thought it was a mistake. She spent hours on hold, listening to cheerful hold music while their lives unraveled in real time. When she finally got through, a representative explained it coldly. Compliance risk means there's concern you won't follow the prescribed treatment. We're not saying you personally. It's statistical. What they didn't say was that the statistics they used were poisoned with bias. Entire neighborhoods, primarily black neighborhoods, were flagged as high risk. People who had never missed a single doctor's appointment were lumped into a database that decided they weren't worth the cost of saving. Meanwhile, Monique, the woman who had fought for her sister Angela, was still digging. Angela's law passed. She partnered with investigative journalists to expose how these denials worked. That's when they met Maria Perez, a former insurance executive turned whistleblower. Maria had seen the files. She'd seen the emails where executives laughed about risk pools and compliance mitigation. And she had the proof, a leaked training manual instructing employees to consider social compliance factors when approving claims. Translation? If you lived in a poor or predominantly black area, you were a financial liability. Maria risked everything to come forward. I couldn't sleep anymore, she said. I watched Good People Die on paper because it was cheaper. With Maria's documents, Monique launched a class action lawsuit. Dozens of families joined, then hundreds. Each story was worse than the last. There was Evelyn Harris, a grandmother denied a life-saving surgery because her profile said she may struggle with post-op care. No one had even spoken to her doctor. There was Marcus Lee, a college student whose claims for anxiety medication were denied because demographic factors suggest non-compliance risk. None of it was medical. It was math twisted into discrimination. The lawsuit exploded in the media. News anchors said the quiet part out loud. Is your zip code? The reason you're dying? Insurance companies went on defense. They called it an algorithm error. They said there was no racial intent. But buried in discovery files, Monique's lawyers found smoking gun after smoking gun. Internal reports marked for executive review only. Charts showing higher denial rates in Black neighborhoods. Emails where executives discussed how tightening compliance criteria saved millions in payouts. One line stood out like blood on white linen. Lower income, high-risk demographics unlikely to litigate, favorable segment for denial. They were betting on silence. But Monique wasn't silent. Protests erupted in Atlanta, Detroit, and Chicago. Families stood outside insurance headquarters with photos of loved ones lost to compliance risk. Doctors, nurses, and even some former insurance employees joined them. The pressure worked. Congress called hearings. Cameras flashed. Maria testified first, her voice shaking but steady. Every denial wasn't just a form letter. It was a death notice. And we knew it. Her words went viral. Millions watched. Hashtags flooded social media. Hashtag Black fatigue. Hashtag compliance kills. Hashtag healthcare justice. Then the moment came. The judge overseeing the lawsuit, an unflinching, sharp-eyed man who had seen decades of legal maneuvering, read his decision aloud. The evidence shows systemic discrimination hidden under the guise of risk management. The court will not allow statistical prejudice to masquerade as medical necessity. Compliance risk is struck down. Gasps filled the courtroom. Reporters ran to phone in their stories. Aisha, holding her daughters. Hands swept. DeShawn didn't live to hear the verdict. But his name, like Angela's, was written into history. That day, the court ordered billions in restitution. Insurance companies were forced to rewrite their policies. And for the first time, regulators announced mandatory audits of every compliance-based denial. But even in victory, Monique refused to stop. She launched the Angela Foundation, a nonprofit to help families appeal wrongful denials. Maria joined her as co-director. Together, they became a force no system could quietly bury. And slowly, the death letters stopped. Today, hospitals can no longer deny care based on compliance risk. Insurance companies can no longer hide bias in code words. The system isn't perfect, but it is better because one grieving sister refused to be quiet. Angela's face now hangs in the lobby of a hospital that once turned her away. Beneath her, portrait in bold letters reads, "She fought for care, so others wouldn't have to." This is what happens when silence breaks. Because the truth is simple, they called it Black fatigue to make it sound like a medical term. But it was never medicine. It was racism rebranded. And now, it's exposed. Justice doesn't erase the pain. It doesn't bring Angela or DeShawn back. But it leaves a warning, carved into the walls of the system. If you bury injustice deep enough, someone will dig it up. And when they do, it won't be quiet.